Hi, moving ALS patients, paralyzed people in bed is always an issue. So we got a satiny, silky type sheet set. This is the pillowcase that came with it. And we used the sheets on the bed for a while. If they're smooth and silky, you can pull a body on it much easier. We got, I guess, cheap ones because they balled up and Christy didn't like them after a while. But we always used the pillowcase. We'd put the pillowcase on the bed, we'd bring her over in her chair, the tub buddy, would get her out of the tub and bring her over here, and then we would lift her up, swing her around, drop her on this. One of the aides would be on the other side, over on the other side of the bed, and then we could pull her over. As she sat on this, it would slide across the sheets well, and we could get her butt out in the middle of the bed, would pull her legs up and lay her head down. That worked well for a long time. She got so that she couldn't support herself at all with her legs. They just wouldn't do anything. And we would grab her around. We had one nurse's aide that was very tall, and she could get under and lift her by her arms. She was a strong individual also. And then bring her and dump her down. But I would try and pull her, get her under her arms and grab her, and then lift her up and then twist her and drop her down. We were having major problems with that because it was throwing my hip joints out. I'd go in, we have a physical therapist who's brilliant and helps us, and he'd have to put my hip joints back in, he'd have to put my SI joint back in, he'd have to put 3 or 4 ribs back in every 2 or 3 weeks. And we were crushing Christy and twisting her also, and it was throwing her ribs out. And that would hurt her, particularly as she laid in bed all of the time. So we finally went to the crane instead of trying to lift her and pull her around. But while she could help, and while she could get some weight on her legs, we could pull her over and drop her down on the silky pillowcase, and then we'd pull the pillowcase across, and it would help us substantially. Just a little tip about the silky sheets. She didn't like sleeping on them, particularly when they balled, so we went to just using the pillowcase instead, and we could pull her over, get her up on the bed easier.